everybody. I'm back today to talk about how my 2 post-op appointments went after my mastectomy. So a week and 8 days after my mastectomy, I had 2 different post-ops because I had 2 different surgeons. A lot of people will just have one surgeon, but I had both a breast surgeon and a plastic surgeon. So I had 2 post-ops. One was with my plastic surgeon's nurse, and the other one was with my breast surgeon. So 7 days after surgery, I went to my plastic surgeon's office and met with her nurse, who very patiently and slowly and kindly took off my dressings and took out my drain. She was a really great nurse because, as I said, she's not in a hurry, and that's exactly what I needed, was someone that didn't feel frantic. Thankfully, it was pretty early in the morning, so she wasn't behind yet. So she just was very, very patient. She used tweezers to take off the Steri-Strips under my little foam bandage that was over here. And I hadn't even seen the Steri-Strips really. The night before, I had taken a shower and one of my 2 bandages had come off, and it was a smaller one over here that kind of went under my armpit. But the main one covering my breast was still there. And so she removed that first, and I was kind of looking down from above. I was not looking across at a mirror. And then she started to slowly take off each of the Steri-Strips with a pair of tweezers. And she just grabbed the edge of each one and pulled very slowly. And thankfully, I still had a lot of numbness. I did put some EMLA cream, some lidocaine cream on underneath my breast, not on the stitches by any means, but underneath the breast where the drain tube was. I put some of that on, so it might have extended up into my breast, but most of my breast is pretty numb anyway, so I didn't really feel much of the Steri-Strips. There was like a tiny little spot kind of in the center of my breast area that was still had some feeling in it and some nerve connection. So I did feel a tiny bit of pain for a slight second during the time that she was taking the Steri-Strips off. And she just looked at my incision and said it looked great and it was healing really well. And then she just put some dressings, just some loose, just fold up dressings like this. Sterile pad, I guess, is the formal name for it, but she just used one of these guys and then just put my bra back on pretty quickly after taking my drain tube out. And that was it. But the drain tube I was even more anxious about because I just had this feeling that since the tube went all the way under my breast toward my sternum and then up and out of my body, that I just thought it would be really painful when she removed it, and so I was kind of bracing myself for pain, and it ended up that it wasn't painful at all. I could feel the movement of it as it came out and up, but it wasn't painful. So I don't know if I still had some nerve block in place, or if my gabapentin was really working well, or if it was that lidocaine cream. Could have been all 3, but I had no reason to be afraid and to brace myself in the end. It was just really quick and easy. And she said that the opening where my drain tube came out would take a day or 2 to close up. And honestly, it only took about a day to close up. So I was expecting to have a lot more oozing and fluid coming out. There was just some that evening in the dressing that she had put on. But after that, it was all dry and scabbed up. So I was very happy to have the drain tube out. It was quite an annoyance. I definitely did not enjoy having it in my body. It was kind of burning at that point and just really annoying because you could feel it under the skin whenever you kind of pushed on the skin, especially on my side. So that was a really nice and smooth, quick and easy appointment. And like I said, I was just super grateful that the nurse was not in a hurry, that she was very concentrated and collected and focused on me. And another thing I was really glad for is that she didn't ask me if I wanted to stand up and look in the mirror and see myself, because that was the first time I would have had a chance to see my incision. And I wasn't ready. And so I was really glad that she just helped me put my bra back on and then helped me put my shirt back on. And there was no pressure to look at it, or I had plenty of a view from up above, but the view from up above was not a complete view, so it was just like a hint of a view, and that was exactly what I needed at that moment. So the next day, I think in the evening, well, in the morning and in the evening, I took a peek at it again and just slowly got used to it. So the following day, I saw my breast surgeon, or my surgical oncologist, and I saw her nurse first for just a few minutes, and she just checked in with me about pain levels and how I was doing in various ways. And then when my surgeon came in, she said a couple of things. First was that I didn't just have DCIS, I actually had 2 millimeters of actual invasive cancer in the middle of my DCIS hiding that we had not detected. So it was a little bit surprising, not terribly surprising, because we knew that was a chance. And there's like a total, I guess on the Pathology Report, it said a total of 20 cells. So very, very young infantile cancer. So we caught it very, very early. I was grateful for that. And honestly, it was not hard news for me to find out that I had invasive cancer, because I felt like if I found out I didn't have invasive cancer and I just had DCIS or precancer, that, you know, maybe I'd always wonder if it was really necessary to have that mastectomy. So now I know it was necessary, and I'm grateful for that. The second piece of news was even more surprising. It was that she got clear margins with the lesion for the invasive cancer, but she did not get clear margins for the DCIS, and the only margin left was my skin, and she was not aware, obviously, when she made the incision and decided where to cut my skin, where the DCIS would end. But it turned out with the Pathology Report that I do still have some skin that is infected with DCIS, potentially, unless they cut it right on the margin. It's possible they cut it right on the edge and there isn't any, but most likely there is a little bit of skin that is still infected. And I didn't even realize up until that point that skin could be infected with DCIS, so that was really interesting. And she proposed that I have an option, and she didn't really have a preference either way, but she said that I could have another surgery to remove a little more skin, and that would give me clear margins, and chances of recurrence would be just a tiny bit better. She feels like it's not that big of a deal, that I really shouldn't feel urgently like I need to have another surgery to remove that skin. And so I told her I would think about it, do some research, and talk to my other oncologists that I trust. And so I'm hoping that this next week I will get an appointment with each of my other oncologists, my medical oncologist and my integrative oncologist, who are both MDs and both live outside of my general area, so a little bit harder to get them, and they're also pretty in demand and pretty busy, so it'll be a little hard to squeeze in an appointment, but I think it'll be a pretty short appointment, so I think it'll be okay. So the other thing is that I had known this before, but I haven't talked about this on any of my videos, that on the day of surgery, they told me after my surgery that they were not able to do the Goldilocks mastectomy. And that was because there was some skin that they identified with DCIS in it, and they had to cut that, and there just wasn't enough, and it wasn't thick enough to do that scraping off of the top dermal layer and overlapping of the skin. And now that I know I have potentially DCIS in my skin, I'm really grateful that they didn't do the Goldilocks mastectomy, because if they had, it would have made it a little messier and a little more difficult maybe to go in and make more incisions and detect where the skin margin is that they're looking for. So I didn't realize there were any possible drawbacks to doing a Goldilocks mastectomy, but that would have been one that would have maybe just been a minor complication, as things have turned out this way. Really grateful that we didn't end up going that route. I still don't feel like I have a concave kind of shape. I feel like if anything it's a little convex, but that's probably because I'm swollen. So, or it could just be that I have really big pecs. Who knows? I don't think I do, but I have done quite a few push-ups over the last few years, so you never know. But I'm hoping I'm not going to be shaped in that kind of concave shape that folks sometimes do when they're thin like me and they have not gotten that Goldilocks mastectomy. So we'll see in, 6 months or a year where everything falls and how things turn out. And I have no idea if I will have that second surgery, but I did set it up in early October. I have a date set, and she said it would be 20 to 30 minutes long, just to take a little bit more of my skin, like a couple square inches maybe, probably not even that much. And I wouldn't have to go under full anesthesia, which is great. That's one of the major things I was trying to avoid with all of this, is to go under anesthesia twice. And like I said, it would just be really short in and out, and there would probably be some more recovery. Like, I imagine I probably would need to take a higher dose of gabapentin again. I don't know, I didn't ask her about that, but I imagine there would be a little bit of a setback to where, I was going from feeling pretty good to feeling kind of like I am now, instead of getting better and better. But it's probably worth it if that's something that my doctors all advise me to do. So I will let you know what they advise me to do, and really I'm pretty reliant on them at this point for that kind of insight and wisdom. So probably just trust what they say as being the best choice. So a little bit tricky, a little bit more than what I expected. I appreciated getting to talk to my surgeon in person about it. My first two post-ops with my plastic surgeon, actually she wasn't there. It was just her nurses, and that was fine. But this was something that was really important to talk about, the fact that I did have cancer. I am a cancer survivor, not just a DCIS survivor. And also this issue with the skin is something I definitely needed to talk to my surgeon about and get her ideas and thoughts about it. She really seemed kind of ambivalent, like she could go either way. So I don't feel pressured by her to do any one route or the other. So we'll see, and I will let you know how that goes. Thanks for following my story. This definitely is a little bit more personal video. This part of my story is maybe unique and doesn't apply to everyone, but might be good to know kind of some of the setbacks and unexpected routes that might come up on your journey. And so let me know if it's helpful to you, and if it is helpful to you, be sure and hit like so that other women can see this video who need to see it. Thanks so much again for following my journey, and I'll see you in the next video very soon. Bye-bye.